Now, let's get this out there. The Delta strain of the virus is not the first, and it certainly will not be the last. But we need to talk about it tonight. Doctors say it is more contagious and should be a concern for people who are not vaccinated. In West Texas, that's a lot of people. Jonathan Polasic picks up the story from here. Hi, Jonathan.
Good evening, Tatum. Here's the deal. It's still COVID-19. The biggest change is how easily it can be transmitted, especially amongst people who are not vaccinated. In fact, the number of people who are fully vaccinated in Midland County sits at 31%, and in Ector County, that number is even lower at 29%. 19's Delta variant is still COVID, with one key difference.
The important thing to understand about the Delta variant is that it doesn't do anything different other than spreading quickly from person to person. So the things that we can do to control the Delta variant would be the same things we used to do to prevent spread.
The question is moving towards the vaccine's effectiveness.
The vaccines now have released trials against the Delta variant that they are still effective. We don't know if there's 95% effective for the Pfizer and Moderna shots because time will tell if it's 95 or not, but we do know it is effective.
And those going without the vaccine, according to experts, are at the highest level of risk.
What's important to keep in mind, for those people in the bucket of no vaccination, they're at the highest risk. The people who have a single vaccination, they're still moderate risk, and the people who have gotten both doses of the vaccine are at the lowest risk.
And while ORMC hasn't reported any cases of the Delta variant just yet, Dr. Sarah Vannon is almost certain that it's here.
As of right now, we don't have any confirmed cases in the hospital of the Delta variant. That does not mean it doesn't exist in the community. I am sure it almost absolutely does. But so we have to be careful. It's just remember, we have a 40% vaccinated population in our area.
Now, Dr. Sarah Vannon wants to tell everyone not to panic. It's just another variant of COVID-19 that happens to spread a little bit easier, and that there will continue to be more variants as we move forward. He said that the biggest thing to understand is how the variants change characteristics in order to give ourselves a better chance at protecting ourselves. Reporting live in Odessa, Jonathan Polasic, News West 9.